Assalamu alaikum. Pre-communication day. We will start with this scenario. Mrs. Jack admitted with a seizure for 3 days, and there was history of papillary adenocarcinoma of the thyroid 2 years ago, underwent thyroidectomy and radioiodine treatment. Been well for the last 18 months. A CT on admission reported showing appearance highly suggestive of cerebral mets. Now she's feeling back to her normal self, expecting to go home today later. Sit with her and explain condition. Okay, we'll start all the time. Hello there.
Yes,
This
hello.
is Dr. Mukhtar, the doctor in the unit today.
Hello.
You must be Mrs. Jack.
Yeah, correct.
Yeah, I know your age, please.
Actually, I'm a 38.
Yeah. How do you feel, Miss Jack?
I'm all right. I'm fine, doctor.
Yeah. Do you want someone to attend this meeting?
Actually, my husband just left. I'm all right. I can be.
Okay. That's great. Can I ask you, what do you know so far about your condition?
Yes, actually, doctor, I was in the work, and during lunchtime, suddenly they told me that before that I felt sick. After that, they told me that I have a jerky movement of all my body, and then they took me to the hospital. This is the things that happen. Yes, and I had a history 2 years back for a thyroid cancer, for which surgery, a removal for my thyroid, and also they give me a radioiodine tablet. I'm actually, doctor, for the last 1.5 years, I'm feeling completely normal.
Yeah, I appreciate your knowledge and your worry about your condition, Mrs. Jack.
Yeah.
Do you have any idea what's ongoing?
Um, Actually, I don't know. Maybe I'm exhausting myself in the work a lot these days. Maybe.
Yeah, I appreciate your concern.
Yeah.
Mrs. Jack, yes, I heard the history from you, and you're right, everything was okay and everything was going fine.
Yeah.
However, yeah, when you had this abnormal movement, shakiness of the body, actually, we did a scan to your head, and I'm afraid to say the scan of the head
Guys, do
suggest
nappy time.
suggesting you have something worrying.
Oh my God,
Are you
doctor.
following me?
Yeah. What are you talking about? Tell me. Mhm. I'm
Yeah,
following.
yeah, I understand your worry, Miss Jack.
Mm.
Actually, the scan of the brain is highly suggestive of showing some abnormal growth in the brain. I'm afraid to say that.
Abnormal growth. Like it could be like a TB. Could be TB. I have a tuberculosis in the past. It could be like an infection, doctor, this abnormal growth.
Yeah, I can see how much you are worried,
Oh.
Miss Jack. Actually, the finding mostly suggested that it might be related to the previous cancer in the thyroid, which was removed before. I'm
Oh
sorry
my
to say
God.
that.
What could be, what do you mean exactly by could be related? Please,
Yeah,
doctor,
it might be
explain more.
cancer, cancer spread
Oh my
from the
God.
previous thyroid cancer.
But doctor, how can this happen, doctor? I have, by the way, a follow-up appointment. It was just 2 weeks back. why the team there didn't pick it early? Why?
Yeah, I appreciate your worry, Miss Jack. Actually, yes, everything was going fine. However, the problem of the cancer might be hidden inside the body without showing any alarming signs, and it might appear as once in case of your condition, what's happened with you yesterday.
Yeah, you
Uh,
are right. By the way, I have no nothing. I have no vision problem. I have nothing. So tell me,
y-
tell me, doctor, does this spread can be cured with chemotherapy? Because I have one of my cousin, I think she had similar problem, and they gave her a chemotherapy. So does this can be cured with a chemotherapy?
I appreciate your knowledge, Mrs. Jack. However, we have no definite diagnosis so far. It's just
Mhm.
suggestion of the spread, cancer spread.
Mhm.
Uh, so we have to be sure that that is spreading from the cancer itself. We have
Mhm.
to do further image and further workup to be
Mhm.
sure this is a spreading cancer. Did you get me?
So, so, doctor, if this is cancer, um, how long left for me? If this, I have the two children, doctor. I want to manage everything from now. If this
Yeah,
is
I
cancer,
appreciate.
how much
Yeah,
left for me?
I can see how much you're worried and frustrating for you, Mrs. Jack. However,
Mhm.
still, as mentioned earlier, we have to do some workup and other images to be sure this is an spreading cancer.
It's all
Okay.
right, doctor. I want to know if this is cancer, how much left for me, doctor? If this is cancer, if
Yes,
this
if
has to
this
be cancer.
this question, yeah, I appreciate your concern, Mrs. Jack, but it's
Yeah.
so early to answer this question. We don't know the nature of this cancer spread, and we don't know is it bad growth or still might be just abnormal growth and might be respond to the management and the treatment. However, we will arrange a meeting with the group of doctors with you
Mhm.
to discuss about further scans, images, and workup, and it might also need some snip if we find tissue
Mhm.
near to the skin to
Mhm.
specify what's the growth of inside these abnormal cells, abnormal
Mhm.
masses. Did you get
Mhm.
me?
Mhm. So what's next step? Tell me.
Yeah. The next we will have a meeting with the nerve surgery doctor, brain surgery doctor, and the gland doctor and surgeon, and they will sit with you to arrange another image proper for your condition to diagnose
Mhm.
what you have exactly. And
Mhm.
after figuring out what you have, they will sit with you again and they will tell you if, the further management plan. Did you get that?
I think you are keeping things from me, doctor. When I'm going to die, doctor. When I'm going to die, doctor. Please tell me.
Yeah, I appreciate your worry, Mrs. Jack. Again, I can reassure you that we still have some time to investigate and to know what's ongoing exactly. All the scan showed was suggestive of a cancer. So I don't have clear answer for your question right now. Are
It's all
you
right, doctor.
following?
Yes,
Yeah.
okay. All right.
Okay, Miss Jack, I can ask you some question.
Please, okay.
Yeah. Um, do you smoke?
No, I don't smoke.
Do you drink alcohol?
Just occasionally, like 1 or 3 glasses at weekend.
Okay, and not exceeding the social limit.
No. If we calculate it in a week, it will be like 6 or
Do you
8.
drive?
No, I don't drive.
Okay, great. Anyone with you dependent on you?
No one dependent on me. I live with my husband. Both we are working, but we are all right.
Hmm. Do you need any help or support at home?
No, I have three children, both in school age. And my job is a part-time thing, so I have a great time with my children, with my family. I'm a financially supported. I'm all right.
Okay, so I will address the concern for you to my consultant and the brain surgeon and the nerve surgeon doctor.
Mhm,
They will have a meeting with you soon to
mhm,
have the plan for you in the
mhm,
next coming days.
mhm.
You have any other concern?
No, not really. Okay. Thank you.
Okay. Till that time, if you feel dizzy, you feel abnormal sensation and abnormal shakiness again, please don't hesitate to call us. And I will
All right.
hand you some leaflet brochure website about your
Mhm.
condition and the hospital contact number. You can contact us as any time you need any help.
All right. All right. Thank you. Okay.
Thank you. Time is up.
Yes, all right. All right.
Yes, you can talk now. Give me
Yes.
the comment.
Yes. You did it great. Actually, this scenario written like this, and they dealt with this as if it's like it's confirmed a brain myth. Although they wrote a highly suggestive, but the comment in the scenario they deal with it as if it's like a confirmed brain myth. And then the scenario flow as you know, she has like a breaking bad news of a brain myth. Uh, you will break the bad news, and then this is what written exactly. And then you will tell her we will give you a follow up. We will deal with you in the MDT team, including like the, as you said, the nerve surgeon, the nerve consultant, the gland doctor. You can touch the palliative team because if this is confirmed brain meds, you have to touch it, just touch it. You will tell her we will sit together and arrange for you the management plan, and we will discuss it in another like a follow-up meeting. And then what else? If this is when she asks me when I'm gonna die, if this because the scenario deal as a brain meds confirmed, you will, as you know, you will tell her, for example, like this is a kind of a really difficult question to be answered. Um, Actually, well, this is advanced and it definitely shorter life. If she insists, you can tell her, I'm really sorry for that. We are maybe talking about months, not years, but this is something like unpredictable. And don't worry, we are gonna give you the full, like the proper management plan and to have a good and quality of life and something. So we'll not specify any time, as you know. And then you will give her like a support, like a psychosocial, as you did. You will ask from the job, the driving, and that's it. But it's really that's what's written in the scenario exactly. They deal with it as a confirmed brain myths. Just so this is my comment.
May I know that is it from a
Oh,
book or you mean mentor or
yes, it's from a book.
yeah? So the deal as Breaking Bad news
Yeah, yeah,
confirmed
confirmed
confirmed by
brain myths.
the scene. Okay.
Yeah, and by the way, you can open you can tell the patient also. For example, Miss Jack, I don't want to bother you, but there is something that I want to speak with you. If you have time, then she will tell you, yes, okay, doctor, tell me. Do you have like any wishes, any like advance directive in case your
Hmm.
health like get worse and so on? Okay, because this is like and she has like months. You can speak about end of life issues. This is from a book, yes.
Yes, I'm wondering because always we are
Yeah,
practicing this scenario as suggestive certainty, still certain uncertainty for the cancer.
yeah.
Even it's yeah, even the highly suggest, but still it's not confirmed, and they have to do some other further scans like CT cap and maybe histopathology to confirm is that cancerous or not or malignant. I mean, so I think. Still, I'm not sure. But if you said yes, this is from a book, so no doubt.
Yeah. Me
Yes.
also, when I like I read it's highly suggestive. I made the same thinking like you. But when
Mhm.
I read the comment, they deal with it as a confirmed premise, maybe highly
Mhm.
suggestive. I don't know. That's it.
Okay. Yeah, let's read the comments.
We can use it is not certain, it is not sure. But if it is brain cancer, it is metastasis to the brain. It will be short in our life, and it will be a matter of months rather than years. But still, I said to you, it is not confirmed, and we have to do further workup. يعني every time I answer the question, but I insist it is not confirmed yet. Can I do this?
Again, Dr. Aisha, you want to what? Again, please.
انا سامع. لا يعني انا قصدي اقول ان انا اجاوب على السؤال، لان هو احتماليه كبيره ان هو يكون فعلا إن هي برين كانسر ميتاستاسيس،
Okay.
ولكن كل شويه اقول لها اقول ان هو still it is uncertain, it is not sure.
Yeah,
We have
I
to
did
do
that. I
further
did that.
work.
Yes.
Yes, as you
By
did.
the way, I did that, but Dr.
Yes,
Roda opinion is according to the book. No, it's like confirmed one. So we have to
but
break bad news and to talk as cancer and metastasis, and she is dying and palliative care and so on, living wish, advance directive. So I think I don't know. So all the opinions as well going with the same palliative because if confirmed palliative because it is MITS, not primary brain cancer. Yeah, but we don't know the histopathology and the histopathology of the cancer itself, the thyroid cancer. But anyway, yes, spreading or MITS means it's cancer because the benign one is not spreading. But the word suggestive means maybe something else abnormal growth apart from being metastasis. This is my point. If confirmed brain MITS or cerebral MITS, I will go with the uh, breaking bad news and so on. But suggestive of cerebral MITS, at least they can write, for example, yes, confirmed brain MITS. So in this time, I will not do the uncertainty. Hidden agenda here, palliative, advanced directive. Yes, I agree, Dr. Ruda. Yes, this is a
Dr.
hidden one.
Basim also, sorry.
Yes.
Also,
Hmm.
the patient make a follow-up before 2 weeks only. How if
Hmm.
it is myths or something like that, how it will miss, yani. I think it is,
Yes,
not
something,
going with,
yes.
mm.
I agree as long as it's suggestive. Once they wrote or they write confirmed or CT cap showed another metastasis in the whole body, lung and liver, bone. This time, definitely this is a cancer and this is a malignant one. But since they are suggesting brain mets, maybe it's not mets at all. Maybe something benign. Maybe it's not mets. How they suggest from the CT, a mets.
And 2 years is too
Metastasis.
much, Sarah.
But I
Too much
think
after thyroidectomy, and it is total
highly
thyroidectomy, I think.
Mhm.
Mm.
and highly suggestive. I think toward confirm يعني
No, no.
highly
We
suggestive
we discussed this
toward
before.
confirm rather than uncertainty. I think so.
We discussed this issue wallahi many times. I can't guarantee this is a cancer or myths unless they wrote it's myths. Since they are saying highly suggestive, still they are suggestive. So still there is work up to confirm this the spreading or the metastasis, which is an MRI, for example. Let's do MRI, or let's do
Mm.
histopathology, or let's do CT CAP. But from CT brain, I will suggest several myths and I will break bad news and the patient will die and so on. I
No,
disagree
I will
with
not.
it.
Yes, I will not
Okay.
discuss the palliative care, but I will say to her if confirmed
Further
myths,
plan. Yes, yes. This is my
definitely
yes.
shorten your life. And if
Yeah, if
confirmed
confirmed. Yes,
myths,
but still not
will
confirmed.
not be operable.
Yeah, this is also my opinion. If confirmed, so
Yes.
far it's not confirmed. So how I can answer all this question like she's dying and she will die within months or weeks or whatever. At least I have confirmed either CT cap, a lot of myths, or MRI because CT brain is still not that much sensitive for the masses unless maybe CT with contrast. Okay, but plain CT will not show, or plain CT will not show the metastasis. Anyway, the debate always make the information more clear and clarified with the discussion. So I hope we can get a home message from this scenario, which is if confirmed, yes, it's clear. Even hidden agenda, if confirmed by any way, either advanced CT or advanced MRI or histopathology or CT cap. This is according to our knowledge, clinical judgment means that it's a cancer with metastasis. Even we can call it many metastases or in multiple organs. In this way, yes, I agree. We will straightforward talk about advanced directive, living wish, palliative therapy. I will not talk about smoking, alcohol. This is my opinion again. The other arm, when we have patient still suggestive, even high suggestive, with plain CT, for example, like this patient, and still even no other B symptoms. They didn't mention at least one B symptom: loss of weight, night sweat, high temperature, any of these constitutional symptoms going with cancer. How I will go with cancer with just CT suggestive of metastasis? I agree with Dr. Roda. This is book opinion, but still, maybe there is something missing or something they didn't explain well, or I don't know what to explain. Anyway, this is my opinion again, and try to get this take-home message. Yeah, thank you, Dr. Roda. Driving, I ask about, yes. Maybe the issue with the writer. Yes, I agree, Dr. Roda. Maybe the writer was not in the mood. Okay, Dr. Qadi, I think. Yeah. He said at the beginning the patient seemed to be fine and relaxed, but you kept saying, I appreciate your worrying. I understand that you are worried. Yeah, I'm just preparing her for something is worrying. I know she's not worried, but yeah, I assume she's worried because I this is the way how to give her bad news. Anyway, yes, I agree not to be like overestimating. She's fine. Why? So I will make her worried. Okay, I agree. I understand that you are worried, but she wasn't worried. Okay, I don't know if we should include the cancer doctor. Of course, I didn't mention, but he is one. For smoking and alcohol, it is if it is good to bring that up now. Yes, for me, if still an uncertainty, I will bring anything. Driving, smoking, and alcohol, and any triggers for the seizure until I will confirm she will die by cancer and this is the spreading cancer and advanced one with loss of weight and so on. No need to stop if she is dying. If she is, but in this scenario, I don't think she is dying. She was fine, even she came with just sudden epilepsy or seizure, which may be related to any other reason, not only the meds. I think we can do as suggestive, but as cancer more than other things. Yes, I agree, but still it's not confirmed. Even palliative here, yes. I'm wondering too. If confirmed, palliative because it is myths, not primary. Yes, I agree. Hidden agenda. I agree, Dr. Roda, it's hidden one, but still, if confirmed diagnosis. Yeah, Dr. Roda said to Dr. Hadi she is worried, yes. Maybe she is showing that she's not worried, but I think she was worried because she has seizure. And the epilepsy in any country, not only UK or Europe, any country, if the patient had seizure, it's very much worrying. It's not something easy to pass. So this is what I assume. Anyway, thank you, Dr. Khadi, for the comments. I hope I pronounce your name in the correct way because it's just written KB. I don't know your full name, but I guess it was Khadi. Thank you, Dr. Roda, for the scenario. I try to make scenario similar to you. Yeah, yes, thank you, Dr. Khadi. I'll bring the scenario. Just wait, Dr. Roda, okay? Okay, Dr. Roda, this is the scenario. By the way, I'm trying to make the similar scenario in the same session, just to clarify the topics and the idea.
Yes,
Okay.
Mrs. John, yes, 55-year-old heavy smoker presented with cough and hemoptysis, high resolution CT chest suggesting of lung cancer for bronchoscopy and CTCAB,
CT cap, chest and abdomen pelvis.
CT chest abdomen and pelvis. Sit with
Yes.
Mr. John.
Mr. Huh? Okay, he is not Mr. Okay.
All right. Okay, 2 minutes, inshallah.
Okay. By the way, this scenario was in Kenya, according to the source. Someone brought the question or the cases from Kenya exam today. So this one was a communication case. Maybe not full explained one, but I try to make it near to the real case because the case only was 2 lines, uncertain lung cancer. So I tried to make it similar to the case in the exam, just in case we have one like this. You ready?
Yes, ready.
Yes.
Yes, ready.
Okay.
Start. Yes.
Yes, you can
Hello
start.
there. I'm Dr. Zain, one of the doctors in the chest clinic. Am I talking to Mr. John, 55-year-old?
Yes, Doctor, I am.
Yeah. It's nice to meet you.
Thank you, Doctor.
Yes, Mr. John, we are here to discuss issues related to your health condition, okay?
Sure, Doctor.
So before starting, do you want to invite anyone to attend the meeting?
Why, Doctor? Is something worrying?
This is really a very concern. Actually, in this kind of a meetings, usually people need someone for a support. Does
No, Doctor,
that
it's okay.
answer?
I am alone now. I'm alone. Yeah, Doctor, go ahead, please.
All right. And yes, so before starting, just to be on the same page, how far do you know about your health condition?
Doctor, I'm suffering since long time from cough, and
Yeah.
recently this cough being with blood. When I saw the blood, really, Doctor, I'm so worried since that time. And I came to my GP, and he referred me to you in the hospital. They did some scans to my lungs and chest, and I'm
Yes.
worried, Doctor, about the results.
And how are you doing so far?
No, Doctor, I'm not doing well. I feel sick, Doctor. I'm not feeling well. I feel after the blood coming in my cough, I feel something is boring, Doctor. I'm scared, Doctor. Anything alarming.
I can understand your worries and I can imagine how your fears. So, what, anything in your mind, what could be the reason for this blood coming with your phlegm?
Yeah, Doctor. I heard from my friends and some of my family about the cough means infection called TB. Is it TB, Doctor?
I can understand your concern and I appreciate your knowledge, really. I will answer this concern in a minute. As you told me that you have this coughing of blood recently, and the team did for you a scan for your chest. I'm afraid that I'm carrying a bad news for you today, Mr. John.
Oh my God. Is it tuberculosis, Doctor? I ask you this question. Is it TB? Is it infection, Doctor?
Actually it showed that it showed that it's not suggestive of a TB, that infection. It's suggestive of a cancer of the lung.
Oh my God. Doctor, why are you talking like it's an infection? You are talking about cancer, Doctor. Are you sure, Doctor?
Actually, yes. In this situation, we revise twice the result of a patient, and it showed that it's suggestive of a lung cancer.
Oh my
I
God.
wish I had a better news for you today, Mr. John.
Oh my God, Doctor.
Really sorry.
Never I think about this. Oh my God, Doctor. I
Do
was
you want
thinking it's just
water?
infection. Yeah, Doctor, please. I'm not feeling well.
Yeah, take this is water.
Okay, thank you.
So, are you able to continue the meeting?
Yeah, Doctor, tell me what you will do with me now.
Yeah. Since it's like a suggestive, still it's a suggestive. Putting out your age, like it's above 50, and you have a coughing up of blood, and the picture on the scan, it's a suggestive, but not yet confirmed. And hence, the team headed by our consultant, the chest consultant, decided for confirmation to do a camera test. We call it a bronchoscopy. Do you have any idea about it?
No, 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 Doctor, at all. I never think I will go hospital, Doctor.
Do you want me to explain?
Yeah, Doctor. What's that
Yeah,
about?
yes, it's a kind of a camera attached to a tube will be passed through your air pipe after numbing the area, so as you will not feel any kind of pain or discomfort. You will be monitored thoroughly. And then through this camera, we will see exactly what's going on inside your chest, an air pipe, I mean. We may take a snip and we will examine it thoroughly, and in our urgent follow-up outpatient appointment, we will discuss the result. And this, of course, after taking your consent. Are you with me?
Yeah, doctor, I can hear you, yes.
Yeah, and this is not only that we are gonna do. We will do also a scan. We call it a CT scan. It's just the same for the same one that we did for your chest, but we are gonna do it for your full body, from you, including your tummy and your groin area. Just in case that if it's like a cancer, we want to see its stage. I mean, if there is any kind of spreading. Am I clear till now?
Yeah, doctor, yeah.
Yeah.
But you make
You
me
know,
more worried
yes.
now, doctor.
I'm really sorry for delivering this kind of news today, but we need to give you the full picture. This is your right, and till now it is just a suggestion. That is why we need to confirm it, and we make all our precautions to give you the proper plan of management. And this depends, of course, on the type of this cancer, if it's confirmed, and this will be done by this camera test, by its if there is a spread or not. Am I clear till now?
Yes, doctor.
And I want to assure you that we will deal with you in a group of specialized team, including with a chest consultant. We will take the ideas from our cancer doctor, if it's confirmed, the Macmillan nurse. We will all, and also the surgeon, we will all work together to see if we need to do any further test and investigation for your lung, for example, for your blood, for further plan of management. And we will speak with this in another meeting. Are you with me?
Yeah, doctor, okay.
Yeah. And you want to, do you have any concern till now?
No, doctor.
I want to tell you that this kind of a camera test, I want to assure you that it's done by experts many times. Don't worry. And it is like any procedure. It has its benefit and side effect. Benefit, it's the best one to see exactly directly what's going on inside your air pipe. And that side effect is like any procedure. You can feel like a discomfort. There is could be like any injury, any infection. But don't worry, this is done by expert many times, and if anything happens, we will deal with it properly. And for the scan that would be done for your whole body, actually, we may inject something, we call it a dye. This kind of dye will be inserted through your blood channel. And this dye will go to your body to see exactly what's, if there is any abnormalities inside. Are you with me till now?
Yeah, doctor, yes.
Yeah. And this kind of dye, some people may have a reaction, but don't worry. We are not give you this kind of a dye and leave you alone, no. We are monitoring you. If any kind of a reaction happens, we will deal with it at once. Besides, we will check your kidney function, of course, with the test that we are going to do. Because in some people, this kind of dye may affect their kidneys. But also don't worry, we are going to take, as I
1
said,
minute remaining.
blood test, and we will keep you hydrated. And we don't worry, we are keeping you under our eye. Am I clear till now?
Yeah, doctor.
And if you agree for these two procedure, to this procedure and this imaging, we are giving you a consent. Read it carefully, sign it without any pressure, and anything written, disadvantage, advantage, and you can withdraw it at any time if you want. Am I clear for now?
Yeah.
Do you have any other concern?
No, doctor.
Then I would like to ask you further question if you don't mind. Yes. Do you smoke?
Yeah, doctor.
Actually, smoking might be related to this condition. I'm advising you to stop it if you don't mind.
Okay.
Okay, thank you.
Your time is up. But if I give you 30 seconds more, what you gonna ask more?
Yes. So what do you do for a living?
Excellent. Yeah. I was a
Yeah.
plumber, doctor, but I left my job.
And actually, we need to investigate further about this job because it might be related to your condition. And this will be discussed with the occupational health worker. Then thank you.
Okay, thank you. Is it occupational health worker or legal advice?
Yes, legal advice also, and
Yeah,
he might need a
legal advice.
compensation.
Yeah.
Yes,
Okay. Well done, Dr. Rhoda.
thank you.
From the beginning till the end, I think you cover the whole concern well. You answer and you address every concern properly. But I wanted you to ask about the job earlier because some patient in these scenarios will be uh, will be valid for compensation, as you know. So especially the cancer, the lung cancer and the bladder cancer. These two types of cancer in bases, they can take compensation, right? It's exposure to the aniline, contrast, and sorry, aniline dye. And in this patient also, if he is plumber in a company, he might have compensation. These are the two scenarios and the two jobs to be valid for compensation. Other points, I think you answered it well. Yes, breaking bad news earlier.
Listen, please,
Yeah.
again, I'm sorry. Plumber and what job?
Uh, One is working in factory for aniline dye.
Okay.
Okay, for cancer bladder. Yes, bladder cancer. Bladder cancer, okay? Bladder cancer and lung cancer. Okay, clear now?
Okay. Yeah.
Okay. So the concern for infection, yes, try to address it, Dr. Oda. You said, yes, I will come to you later, but say it first. Yeah, this is not an infection. So what, doctor? It is a cancer. So answer the concern, then give me the breaking bad news. Okay? Don't postpone it. Yeah, because every concern you should answer and it will have mark. Yes, Dr. Shayna. Sorry?
أي concern بالمشكلة بالإنسان.
Yeah, yes, you must answer every concern. So if I ask her, do I have a TB or tuberculosis infection? She can say, no, it's not. I appreciate your worried. I appreciate your concern. I appreciate your knowledge. It's not an infection, not TB. So what is it, doctor? Yeah, I'm afraid to say it's a cancer. Then, as we know, the golden silence and let her react or let him react. Then continue your explanation about the cancer, the lung cancer due to. And by the way, don't ask about smoker. He is a smoker. It's written there. You can tell him, yeah, because since you are smoking for a long time, it might be related, and I can advise you to stop smoking until we confirm the diagnosis. Because if not cancer, it might worsen the condition. If cancer, it might worsen the condition, and if not cancer, it might lead to other disease. One of them is the cancer. So this is regarding the smoking. I heard one day from Dr. Ahmad. He said every word in the scenario means something. So whenever they wrote for you smoker, so no need to ask about smoking. So he is smoking or he is smoker. So don't offer the question again. You got this. I believe it's accepted one, yes. If also they wrote for you the job, he is plumber. So don't ask him what's your job. Just try to put it in a sentence. Since you are plumber, this the exposure to the chemicals make you having the risk for having the cancer. I think this is the way how to explain something written. Try to put it in your paper and put it in a sentence without asking it, because they are saying that the knowledge or the information written for you, you are using it and you are focusing, concentrating what's written, not something you ask about and which is already written. So you are not concentrating about the information in the card. Try to write it and offer it in the discussion without asking about it. Okay, this is the same for the data, patient name and age. If you go to the patient and ask him, what's your name, what's your age? So why they give you the name and age in the paper? Unless you forget, it's okay. But try to focus about every word in the scenario, to put it in the paper before going to the patient, because you will use it as a weapon and you can do it in the discussion. I think apart from this, you did great, Dr. Roda, the consent for the CT cap, the consent for the camera scan, but the chest consultant, you can say lung doctor or lung consultant. Apart from this, you did great about the dye also of the CT cap, the kidney function test follow-up, monitoring the kidney function. All these things you cover it well. No need here for advanced directive or living wish, and the patient already still not diagnosed yet. Okay. Now this is another complementary scenario for the previous one. Just how to deal with uncertainty, cancer uncertainty. No, suggestive, Dr. Roda. It's written suggestive. Where the scenario suggesting of lung cancer. So still you uncertainty. Yes. Do we have to, Dr. Fad, do we have to mention the dye injection in the CT cap? Yes, sure. The patient might have kidney failure or at least impairment post-contrast. In breaking bad news, I think it is crucial to ask if the patient has someone to drive him home and if they have support at home, such as family. Yes, you can offer the support, but for that driving, he has no problem with the driving. So someone can take him home, no problem. He is fit and he has no issue with the driving. Okay, suggested. Dr. here dealt with and suggested or confirmed. No, it was suggested. You did it well. And they will do the workup, CT and bronchoscopy, yes, as you did. When break the bad news, don't let patient take deep breath several times. Whenever he mentioned TB, directly more serious than TB and deliver the news quickly. Yes, I agree. So if he is worried and he's thinking and asking and repeating, so answer him immediately. No, it's not a TB. So doctor, what is it? It's a cancer. Then golden silence. Let him react, being angry or whatever, and you can offer him support, tissue or water, then proceed. And try not to ask him, are you able to continue? Because he will continue this meeting by any way. Even he is not good, he's not feeling well, he will continue this meeting because this is the meeting for the exam. Okay, Dr. Oda, don't tell him, yeah, are you able to? He should be able. Okay, unless he will die in front of you. Okay, any concern, any comment? I hope both the scenarios were clear so far. So the previous scenario, I will also deal with this, even the exam, I will deal with the scenario as uncertainty until they will tell me it's a cancer or it's a myth, confirmed one. The word suggesting or suggestive or likely will make me do the scenario as uncertainty till we have proof for the cancer. We know what the proof for the cancer. Histopathology wise or CT cap staging, lymphadenopathy with also biopsy. This what we are in real practicing. Apart from this, still suggestive. Okay, I hope it's clear as a take-home message. Any question, any concern, any comment? Okay, it's Thursday, going to the weekend. If no question, we can end early today. Have a nice weekend. See you on Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Salam.